Audio, check, check, check. Hello there, folks. This here's your Uncle Troy, or Uncle Neckbeard, as the picture shows. I've not shaved in a while. Uh, just a little update here. This is the C Word episode 19, I think. For those of you that don't keep track, this is my ongoing video log or audio blog today of my fight with cancer. This is not one of the happy-go-lucky fun and games videos. So if that's what you're looking for, feel free to click away. There's about 600 other videos on this channel. I'm sure you'll find something you like. Okay, to recap, since it's been a while since I've posted a video, about a year ago in May of 2013, I was diagnosed with metastatic colon cancer. Metastatic means that the cancer has learned to exist outside of the organ where it originated. So I've got tumors, in addition to the main tumor in my rectum. I've got tumors in a bunch of lymph nodes, a few in the liver, and several in both lungs. These are all very small, and it's a slow-growing cancer, so they're not going to get big very fast. But I've been taking chemotherapy for the last year and it's been shrinking them until the very last CT where it said it was stable from the last time, meaning no significant changes. So I'm stable right now. Anyway, but the cancer is not what we're going to talk about today, even though this is a cancer blog. In addition to the cancer, a few months after I started chemotherapy, I started having some pain around my anus, and it got so bad, and also I was leaking some blood from places where blood shouldn't be leaking, and it got so bad that I actually went to the ER one day, and once they got me to stop puking and pooping all over the place, which was the main problem I came in with, they basically sent me home. ER is a great place to go if you're dying, but if you're not going to be dead in 24 to 48 hours, you might as well go to a regular doctor. They can't really fix you in the ER. They just keep you from dying until they can get a regular doctor to look at you. And I say this after working in hospitals for 19 years. If you're not going to die in the next 24 hours, don't go to the ER. Anyway, so the next Monday I was in extreme pain, and I was supposed to have chemotherapy that morning, but instead I called them up and said, I'm in too much pain, I can't do the chemotherapy. So they said, well, come in and see the doctor then. So I was certain when I got there that she was going to say, oh, that doesn't look too bad, you can go ahead and have your chemotherapy. But I felt terrible, fever, pain in my anal area where you're not supposed to have pain. Anyway, so, but instead she looked at me and turned to the nurse and said, call the hospital and get him a room. And then turned to me and said, who is your surgeon? And it turned out I had anal abscesses, pockets of fluid in the butt, and there are parts of your butt which are purely decorative, and there are parts which are structural that you put a strain on when you sit down. And these abscesses were in the part where you put strain on them when you sit down, which would explain why it hurt more when I sat down. So they put me in the hospital on a Monday, I believe in August of 2013. I'm not exactly sure. And they pumped me full of antibiotics, IV antibiotics, intravenous antibiotics, for about 3 or 4 days, hoping to get the infection down, get the swelling down, and not have to cut me. And it turned out that the IV fluids or IV antibiotics weren't enough. So the surgeon took me into this operating room and found where the abscess had forced a hole in my butt for the fluid to drain out. So he just cut where that hole was down to the source of the abscess, debrided out all the infected tissue. That's what they call it when you clean out infected tissue, debriding. And just didn't even sew me back up. Just packed me full of gauze, sent me back to the room. So I woke up, later, basically packed full of gauze. And every day he'd come in, he'd pull a piece of gauze out, and of course I'd call him a few choice words because that didn't feel good. And basically the plan was that hopefully the abscesses, now that he'd opened it up, cleared out all the infected tissue, they would heal from the inside out, and I would be better. I'd be well. And what actually happened was they kind of just healed over and kept draining and kept hurting every so often. But compared to what it was before the surgery, this, it was nothing. If the surgery, pre-pain surgery, was on a scale of 1 to 10, a 10, and I don't use that term lightly, the pain after the surgery was like 1 or 2, just enough to be annoying. So that went on for months. Basically, it would hurt sometimes. It would drain about every day, but just enough to be annoying, not enough to be debilitating, and not enough for me to take him up on the offer of going back into the hospital, having another procedure, and seeing if he can fix it. Just was not at all interested in doing that. So that went on for like a year, and then just a few weeks ago, here in middle of June, maybe early June or whatever, I started having more pain, more drainage, and more swelling in the area. It kind of puffed up, felt hot, just not good. And of course, I was feeling not good and running a fever. So the actually that happened a couple times in the last month, and my surgeon, one of the times I'd seen him when it was flared up and not feeling good, he wrote me a prescription for some antibiotics with several refills, and basically said anytime you start having fever, swelling, the drainage starts looking funny colors, just go ahead and take that week worth of amoxicillin and see if that doesn't clear it up. And in the past, after a couple of days, it had cleared up. And of course, anytime you take an antibiotic like amoxicillin, you need to take the entire dose. So I would take the entire week's supply, even though the pain and swelling went away after a day or two. So a couple of Wednesdays back, a couple of weeks ago, on a Wednesday, I was supposed to have chemotherapy, but the night before I'd woke up in the middle of the night in extreme pain. My abscesses were acting up. And so I called him in the morning and basically said, I'm not going to be coming in today. The abscesses are acting up. The doctors give me antibiotics, usually clears it up in a couple of days. And I said, okay, we'll come in Monday. So after a couple of days, I started feeling better, but then I started feeling worse again. Just feeling bad, pain, swelling, drainage was weird colors. So come Monday, I had almost talked myself into it doesn't hurt that bad. I can stand sitting on it for a few hours while I have my chemotherapy. They're nice, comfortable chairs. I can lean them back and lay on my side anyway. And so we were getting ready to go to the chemotherapy when I just changed my mind and told my mom, no, drive me to the doctor instead, the surgeon. So we showed up at the surgeon's office before they opened in the morning, like 8:30. When they did open, they explained that the surgeon was off at the hospital doing rounds of the various people he had done surgery on and wouldn't be in the office until 10 o'clock. So we had a chance to run to Hardee's and get a chicken biscuit and, get a drink there. So we got back about the time he got back from the office, and he poked and prodded, and I was certain that he would do like he had done in the past. He would poke and prod, decide that it wasn't that bad, it was just an annoyance, no reason to do anything about it. Certainly don't put him in the hospital. Just keep monitoring it, come back and see me in a month. But this time he poked around and he said, here's your problem. You've got an abscess. And I said, yeah, I've got 2 of them, because, he went into surgery to fix one of them and found a second inflamed area that he cut into, and both of them are still draining. And he says, no, you've got a new spot here. You got a spot here about the size of a $50, which was news to me, because basically anyway, but it turned out that was the place that was infected. That was the place that was swelling up. That was the place that was hurting. Of course, the whole area hurt, so I couldn't really, zoom in on it. I couldn't tell you exactly where it hurt. Just the whole area was in pain. So he asked me, can you handle a little numbing medicine? And I wasn't sure exactly what he meant by that, but I said sure. So he had the nurse get a tray together to lance the abscess. While he went off to take care of another patient for a few minutes, and he came back, poked me about 3 times with a needle, and pumped me full of lidocaine or some other local anesthetic, and waited a few minutes, poked me a couple times. It didn't really hurt, so he started. I'm not sure exactly what he did. I couldn't see it from my angle. I was too busy staring at a spot on the wall, and so he started cutting on me, I assume, and getting the whatever was in the abscess out, and that hurt. And I mean, apparently, infected, stressed tissue like around an abscess doesn't numb very well. He told me that after he had started on me. He didn't like give me a heads up before. So I could feel some of what he was doing, and it hurt. Not as bad as it had hurt, laying in bed the night before when it flared up, but it was, sudden sharp pains that were, if you got a slow, steady pain, even if it's real bad, you can handle it. But I can handle it better than a sharp, sudden pain. So every time he would do something, I'd catch my breath. I would try not to move. Clamp. My legs were cramping, trying to hold still for him. I made a fist so tight I broke a fingernail. It's healing up nicely, by the way. So eventually he finished cutting and manipulating and doing whatever he was doing, and he started putting gauze in the hole, long ribbon-like gauze. And it felt like he stuffed about 10 feet worth of gauze in there. Excuse me. And like I said, this was on a Monday, so he said, I'll see you Thursday. Stuffed the crack of my butt full of 4x4 gauze, pulled up my pants, and sent me off into the world. And also told me to refill the amoxicillin and take another week's worth. So I did that, and it hurt a little. It was sore. It was tender. And every time that gauze would catch on my underwear or whatever, it would hurt, but nothing like it was pre-procedure. Nothing like it was the night before, when it would swell up and start hurting. So I went back Thursday. Oh, and he also told me don't pull the gauze out. When I was in the hospital, the previous procedure he'd done on me, he'd stuffed me full of gauze. At one point I was wiping my butt. I caught the corner of the gauze and I pulled it out, one of the pieces of gauze that he didn't want pulled out just yet. And he made me feel bad, telling me that piece of gauze shouldn't have been pulled out yet. On the other hand, it hurt so bad at the time that I feel I did my penance. So if you take it out nice and slow, it doesn't hurt very much. If you just rank it like a starter cord, it hurts. Anyway, so he said don't pull the gauze out. If the gauze works its own way out, just snip it off, but don't pull on it. So come back Thursday, the gauze had stayed where it was. Surprise, surprise. So he pulled about a half foot out, snipped it off. And my brother had actually taken me back Thursday. And so the doctor said, come over here. I want you to see this. And showed him how he was pulling 6 inches of gauze out of my butt, snipping it off. And said every other day, do that until it's all out. Because I couldn't do it myself because I couldn't see, and I couldn't, see how far I was pulling or where to snip. And again, stuffed my crack of my butt full of 4x4 gauze and sent me off into the world. So it actually took two pullings and snippings to completely remove the gauze, which meant there was only a foot left in there, which surprised me because it felt like he had stuffed 10 foot worth in when he did the procedure to start with. So today I'm on my last day of antibiotics. The drainage went from black, blood clotty looking stuff to bloody to pinkish now. It's still draining, but it's not hurting at all. I'm sitting on my butt right now for the first time in months, maybe, without any pain at all, which is amazing to me. The pain that I had been blaming on the abscesses that had already been treated turns out probably wasn't the case, at least most of the time. It was this new abscess that was forming. The pain was spread over a big area, so I didn't realize the pain wasn't coming from the places where it had been coming from. So that's where we are now. I'm waiting till this next Thursday. I'll be going back to see the doctor again. If I've healed up enough, he'll release me to go back to the chemo doctor who wants to examine me before she clears me for chemotherapy. So at least another week or two before I go back to chemotherapy. I've been about 3-4 weeks without chemotherapy now, and I feel better than I felt in a year. But that's just because I've been off the chemotherapy. But we want to get back on the chemotherapy as soon as possible because the chemotherapy has stopped making the tumors smaller. It's just keeping them stable. So we need to keep hammering the cancer to keep it from growing. So I'm hoping after this Thursday I can be cleared, call the chemo doctor, hopefully get a very quick time to see her, and then get back on the chemo maybe the next week or the week after at the latest. So what else is going on? I've received my first payment from Social Security Disability, even though I've got paperwork here that basically says fill this in and send it back before we can start your chemotherapy. Or before we can start your disability. So I'm not sure what it is. Of course, I've also got a letter saying that your disability or benefits have been approved and have started. And like I said, I've already received my first deposit. They direct deposited it, so it was in the bank for a couple of weeks till the statement came in the mail, and I knew that the money had got there. Sorry about that. Since my beard has grown out, I've started stroking it like a cat or something. I don't know what I'm doing. But since the long-term disability was about to run out, the fact that the Social Security disability has started is good. I'm not sure how much longer the health care through COBRA is going to last from my employer. I need to call and check on that because it's been a year, and I can't remember if it was a year or 18 months that it was good for. But I need insurance because the last bill I got from the chemotherapy doctor was something like $80,000, and then the insurance had paid all but like $300 of it. So without insurance, I would not be able to get my chemotherapy, and I would die. So I need to check that today. I think that's everything now. So please hit the thumbs up button. Leave comments in the comment section below. I know it's weird to thumbs up a cancer video, but that's just how YouTube works. The more user interaction, the more it thinks the video is popular. The more popular the video, the higher it is in search rankings. So people looking for videos about surviving cancer and chemotherapy can find my videos. So thumbs up if you don't mind. This is Uncle Troy signing out. Please have a good night.